Hi, everyone. Thank you so much for having me today. It's truly an honor to be invited to meet and discuss and present this information to all of our families. So as previously mentioned, my name is Susana Zavala. I'm one of the clinicians at the West Dallas Youth and Family Center, which is one of the clinics that provide support to our students in Dallas ISD. Next slide, please. So just an overview of the objectives today that we will be discussing. I'm going to share with you all a little bit about our mental health services department and what we do, what type of services we provide and offer. We're going to discuss signs of COVID that may be impacting students, that parents might be seeing, signs to recognize, and how you can better support your student. Coping skills, we're going to discuss some of those and additional resources that are available in the community. And then I'm also going to be sharing some information over the vaccine. Next slide, please. So as I mentioned before, I am one of the clinicians for the Mental Health Services Department. And so just to inform you a little bit about what the Mental Health Services Department is, it provides mental and physical health services to Dallas ISD students and their families. And so all clinicians have advanced degrees. They are licensed mental health providers, and we collaborate also, the mental health clinicians collaborate with psychiatrists within our clinics and other DISD departments as well, outside agencies, nonprofit organizations, and we all collaborate to better support our students. So while the health and the well-being are our primary focus, our most significant impact is student achievement. And so we want to make sure that our students are successful in their academics. And so we want to make sure that they are able to be supported in all areas. And so we want to make sure that these services are available to them. And so we want to make sure that the community is aware of it so that they can know who to reach out to if they need any type of support or help. And again, we collaborate with, the departments, with teachers, school counselors, school principals, other outside agencies as well, to better support our students. Next slide, please. And so here is going to be some information over the types of services that the mental health department provides. So we have our clinic-based services, which basically consist of 12 youth and family center locations throughout Dallas ISD. And so each clinic has elementaries, middle schools, and high schools assigned to them. And basically what we do is we provide evaluations, psychosocial assessment for students, provide individual, family, and group counseling. As I mentioned before, that we collaborate with psychiatrists, and so we have psychiatric consultation available that provide also medication management if needed. We provide parent education workshops in order to provide education to parents related to mental health, abuse, in order to help parents gain that knowledge. We also have our clinics have Parkland Hospital next door to the clinics, where Parkland provides physical health services to the Dallas County children ages 5 to 19. And this is through a collaboration partnership with Dallas ISD. Additional services that the Parkland Hospital Health Services provides is physicals, sick and well child visits. They provide management of chronic illnesses such as asthma, obesity, diabetes, anything in relation to that. They also provide immunizations, specialty referrals if those are needed. They also provide family planning, pregnancy testing, STI, and HIV testing. So if those services is something that you're needing, please feel free to contact our Parkland Hospital Health Services line, which will provide information on that. They also provide health education, referrals to laboratory, x-rays, or pharmacy services as well. And if for some reason you were to need additional referrals to other community agencies, that they can do that as well. Next slide, please. Another type of services that the Mental Health Services Department provides is our school-based services. So we just previously discussed, or I just previously shared with you what the clinic-based services provides, but we also have our school-based team. And so they provide consultation about emotional, social, and behavioral issues which impact learning. And so these school-based clinicians are in the school setting. And so they respond to threats of suicide and violence for all students. They also provide individual and group counseling. This might look more of a short-term treatment or interventions, about 4 to 6 sessions. But if for some reason they require long-term care, they can always make a referral to our clinic-based clinicians or provide additional resources or referrals as well. And they provide, like I said, behavioral and emotional support on campus. Next slide, please. In addition to the school-based services that are part of the mental health services department, we also have our alcohol and drug intervention program. So this basically provides information regarding substance abuse education, intervention services to Dallas ISD students and families. There's also the primary scope for this is to increase that awareness, expand prevention, and help facilitate interventions that will help empower students to have recovery skills and make healthy life choices for students who might be struggling with substance abuse. Next slide, please. All right, so here's the information in regards to COVID support. And so, as previously mentioned as well, families have had to adapt within the last year as many have faced different challenges during the pandemic. It has been a challenging year for everybody, right? And so with COVID still being something that's ongoing, it has caused a lot of stress to families, to children, to adults. And so here's an overview just of some signs or symptoms that you might notice in children. And symptoms might look a little bit different from preschoolers through elementary school children to adolescents. And so preschoolers, you might see some sucking, bedwetting, clinging to parents. You might notice some sleep disturbances, maybe not being able to fall asleep, not being able to stay asleep, maybe having nightmares, loss of appetite, fear of the dark, regression in behavior. So maybe starting to see some behaviors that they haven't done in a long time, and then withdrawing as well. And so then we also have the elementary school children. You might notice some irritability, showing some signs of aggression, maybe with their words, maybe with their behavior. So physical and verbal aggression. You might notice some clinginess as well. So kind of wanting just to stay near you, not wanting to leave you alone, wanting to go wherever you're going. They might also experience nightmares and that lack of sleep or changes in their sleep pattern. You might notice some school avoidance, which has been high for a lot of students, not wanting to do schoolwork, not trying to engage in their school, not wanting to connect to classes, or concentration due to the many changes around, not having a routine. It might cause them to have little to no concentration and withdrawing from activities and friends. So maybe not socializing as much. And obviously socializing might look a little bit different nowadays because of COVID, but not talking to them on the phone anymore, not engaging with them, not having that constant communication or contact. We also see in adolescents that sleeping and eating disturbances. So maybe eating more, eating less, decrease or increase in appetite, agitation, increase in conflicts, like within relationships, physical complaints, delinquent behavior, and poor concentration. And please know that although that these are just some signs that you might see or might notice, there could be more, there could be different for everybody. And please know that most children are managed well with the support of parents and other family members, even if showing signs of some anxiety or concerns, such as difficulty sleeping or concentrating. Some children, however, have more risk factors for more intense reactions, including some severe anxiety, depression, suicidal behavior. Other risk factors can include that could be impacting these signs or these symptoms or this anxiety or depression could also be due to previous traumatic experiences or other abuse that they have experienced in the past, family instability, or maybe the loss of a loved one or the loss of a close relative or family friend. So please know that if symptoms are persistent, if it's something that you've noticed that's been ongoing, parents or caregivers should contact a professional to seek that professional help. Next slide, please. So here are some information, just ways to cope, right? We talked about coping skills earlier, the deep breathing, the mindfulness activities. Those are great. So just with elementary school children, providing this communication as far as being brief, giving simple information about COVID, talk about the efforts to keep them healthy, keep them safe, give simple examples of the steps made every day to stop germs, like such as washing hands, right? You can make it into a fun game, a sing-along song, washing your hands and staying healthy. For the older kids, upper elementary and early middle school children, they are often more vocal about how they feel, their concerns, maybe of things that are going on. And so they might ask more questions about whether if they are safe and what will happen if COVID-19 spreads. They may need assistance separating reality from rumor and fantasy. And so obviously with COVID-19 being a thing that's been ongoing, we continue to see it in the news, right? And so a lot of the times we might see that false information on the news or on the media, on social media especially. And so they might look for adults for guidance on how to react to stressful events. And so acknowledge some level of concern without panicking, right? Because we model that behavior to our kids. And so if we panic, they panic. So acknowledge there is obviously a concern to what's happening. That's appropriate. And then finding ways to help them, taking the necessary actions to reduce the risk of illness. Again, practicing those social distancing, washing our hands, wearing our masks, and keeping this information age appropriate, right? We wouldn't want to be sharing information to our early elementary kids compared to the information maybe that we're discussing or communicating with our high school students, right? Next slide, please. So this is more geared towards the middle and high school students. They're more vocal, right? And so they share more about maybe what might be going on. And so just being honest with them, provide honest, accurate, and factual information. Their level of understanding is different compared to early childhood children. And so be honest about the current status. Engage them in decision making about family plans, scheduling, and helping with chores. For all kids, it's important for them to continue to have a routine and staying connected to school. Parents being sure that they are able to stay connected with teachers, receiving that information with them, making sure that the information that you're getting is from teachers and as a way to continue to support your children through school. And also to connect with other school staff. They share these great virtual events where we can receive different information on resources that are available to families. And so that's another great tool to use. Staying in contact with the teachers, other relevant school staff, school counselors. If there are any concerns about how they're coping and keeping and just learning ways to support them and keeping up with assignments and activities, those are all important. Next slide, please. We also have coping through our boundary settings, right? And so we talked about how there's sometimes news that's not accurate. So that we see rumors that might not be true, that might not be real information on social media that kids see. Kids have access to social media a lot of the times. And so making sure that we are able to set boundaries with those things. And so parents should be monitoring television, internet, social media viewing, not just only for kids, but for ourselves as well. Sometimes for our own mental health and our well-being, we have to limit how much news we're watching, how much information we're hearing in order to be able to maintain that level of stress. And so watching continued updates of COVID-19 may increase that fear and anxiety. Developmentally inappropriate information. Again, this falls into that information of that kids might be listening to in the background if you have the TV on, that might not be appropriate for them to understand. So information that might be only designated for adults. So that can also cause that anxiety, that confusion, especially for these young children. Dispel rumors and inaccurate information. So again, explaining to your child that many stories of COVID-19 on the internet may include rumors and might not be inaccurate information. And so just again, teaching children positive preventative measures, right? When talking with them about their fears, giving them a sense of control over their risk of infection can help reduce anxiety. Getting creative in ways you can communicate with family members to stay connected, having flexibility, showing compassion, and then also demonstrating them and helping them develop problem-solving skills. Next slide, please. And so a lot of the times we might wonder, like, well, how do I approach this conversation with them about how to talk to them about COVID-19, what's happening around that? I don't want to tell them too much. I don't want to worry them. I don't want to scare them. But I want them to be mindful of what's happening, right? Or be aware at some level of what's going on around them. And so this is just such an important tool, letting your children's question guide you. So this prevents you from oversharing and overloading them with information that they might not need, that they might not be wondering about. And so often children and youth do not talk about their concerns because they are confused and don't want to worry loved ones. Younger children absorb scary information in waves. They ask questions, listen, play, and then repeat the cycle. So children always feel empowered if they can control some aspects of their life. And having a sense of control reduces some of that fear. And so again, just allowing them to ask questions and that being a guide to you. And you just being direct with the questions, being age appropriate and your responses, and just providing some reassurance of your safety and their safety. Next slide, please. So here are some techniques of Miss Martinez shares some wonderful ways to cope with stress. And so these are additional tools that you could use as well. She mentioned the deep breathing, the square deep breathing, the mindfulness, right? Being in the present, being in the moment. And so demonstrating deep breathing is a valuable tool for calming the nervous system. And so doing and practicing deep breathing exercises with your children. There are several different deep breathing exercises for all age groups. And so you can do bubble breathing, you can do mindfulness breathing, you can do the square breathing, right? And so depending on the age level of your child, and remembering to practice these techniques whenever you're in a calm state, so that whenever we need them, our brain has registered that information, has practiced, and knows what to do to practice that deep breathing in those moments of high stress. And focusing on the positive, celebrating that positivity, right? Celebrate having more time to spend with family, making it as fun as possible, coming up maybe with schedules of like, okay, Tuesday night is board game night, Wednesday's night is taco night. So getting creative and allowing your kids to participate in that as well. Engaging in different exciting activities, going outside maybe whenever it's a nice and beautiful day, sing, laugh, and if possible to connect with nature and getting that needed exercise, which does well. Allow older children to connect with their friends virtually. So a lot of kids are tech savvy, and so just being able to stay connected with their friends if being able to gather is not safe or it's not an option at the moment. Next slide, please. Other things that are important and that could be beneficial is establishing and maintaining that daily routine. With COVID-19 and doing distance learning, being very limited with our activities that we can do due to not being able to socialize. Having a regular schedule provides a sense of control, predictability, calm, and well-being. So continuing to have those routines, like if we work back in school, right? What would that schedule look like? Getting up at a certain time and having my breakfast, right? And going to bed at a decent time as well. That sleep hygiene is so important and critical to our students, and to ourselves, for ourselves as well. Identify projects that might be helpful to others. This might include maybe writing letters to our neighbors who might be stuck at home and alone, or maybe writing letters to healthcare workers. So just getting creative with different projects and ideas that could keep your kids engaged and busy doing different things, right? Sending positive messages over social media, reading a favorite book, watching videos, right? Learning videos, or even finding some meditation or deep breathing videos on YouTube for younger children to hear. And then lastly, offer lots of love and affection. That's so important nowadays. Next slide, please. And so again, just to remind you that our Mental Health Services Department, Youth and Family Centers is available to all of our DISD students and families. And so here's just some information where you can reach your nearest center. Here's our website that I'm sure can be provided in the chat for any parents or any families or caregivers that are interested. Here we've attached the information specifically to our clinic, the West Dallas Youth and Family Center. But remember that we have 12 clinics all across the Dallas ISD. And so here's our contact information. Of course, we've also included the school-based information. If you have any questions or need to report a crisis, contact your Skyline school-based clinician. Here's some contact information. And then earlier in one of the early slides, I talked about the Parkland Physical Health Services. And so if there's anyone that's interested in any of those type of services, this is for physical well exams, immunizations, then you can contact this phone number. And so our specific clinic, the West Dallas Clinic, is currently only seeing students at our location on Mondays and Wednesdays. And so please know that other clinics might have different days that they are scheduling students to see in person. Next slide, please. Here's an additional resource. And so please know that if you have challenges that due to COVID-19, any anxiety, any stress, please know that this resource is available. It's a program through the Baylor College of Medicine and Harris Health System, and it's offering free therapy over Zoom to parents and children experiencing stress and anxiety related to COVID-19 pandemic. And so here's some brief information over it. It's over 6-week, 60-minute sessions by trained therapists, and it's one-on-one therapy to parents and covering how to address the child's anxiety, depressive symptoms, and how to better support your child through this pandemic by teaching you and developing effective coping skills. And so if anybody wants this information, it's available as well. And again, this is just an additional resource that's available to the community. Next slide, please. So now I'm just going to briefly cover information over the vaccine. And so please note that this information has been shared from the Center of Disease and Prevention, Parkland, and Dallas County. And so here I'm just going to cover some brief information over key things to know. And so please know that the COVID-19 vaccines are safe and effective. They do not cause you to test positive. You might experience some side effects after the vaccination, but these are normal symptoms. It does not mean that you are positive to COVID-19. Some side effects might include like flu-like symptoms, but it just means that the vaccine is working and it's not a cause for concern. Symptoms can go away after a day or two. As of March 29, 2021, everyone 16 and older is now eligible to receive the COVID-19 vaccine in Texas. The vaccine works by teaching your body how to defend against the COVID-19 infection to keep you from getting seriously ill. It typically takes 2 weeks after you are fully vaccinated for the body to build that protection, that immunity against the virus. And then also vaccines will become widely available in the coming months. And so as we saw throughout the past few months, it has made progressions of who it becomes available to. People who have been fully vaccinated can start to do things that they have stopped doing because of the pandemic. So the more people who receive the vaccine, the quicker we can get back to the more normal life, including visiting family, friends, attending worship services, going to sports events, entertainment, and other activities. The vaccine will also help stop the spread of the virus in the community and end the pandemic. So the more people become vaccinated, it reduces the spread of the COVID-19. The vaccine helps protect you from getting sick and spreading the virus to others, and can also lessen the symptoms if you do get sick. Next slide, please. So things that we are still learning, how well the vaccine prevents you from spreading the virus that causes COVID-19 to others, even if you do not have symptoms. We're still learning how the vaccine protects people. We're still learning how many people have to be vaccinated before most people can consider being protected, right? That population immunity. And we are still learning how effective the vaccine is against new variants. As we know that new variants we've become aware of new variants of the virus that cause COVID-19. And so they are still continuing to learn how effective it can be against those new variants. It's important to also know that people should continue to practice preventative measures such as wearing a mask, social distancing, and washing your hands in order to stop that spread of the virus, even after the vaccine. The vaccine is an important tool in controlling the pandemic, but it's not a magic bullet, right? And so it can't end the pandemic right away. And so that's why it's important that we continue to take those preventative measures. And lastly, my next slide, please. Lastly, this is just information, again, from the county, just on ways how to register. And so Dallas County is offering different vaccine operations. Couple are at the Fair Park, Potter's House, and registering by phone. So please know that if you choose to, here are places you can enroll. It is a personal decision, and here is the info on how you can get that. You can visit the Dallas County website, and you can find that information there. Please know that the vaccine is free. It is a federal program that's paying all costs associated with the vaccine. After you register, you are contacted by one of the state hubs, which is one of the locations where they're providing the vaccine, to schedule your appointment. And they're basing it off of eligibility and supply as well. You will need to provide an ID, and the vaccine is available to anyone that wants it. The hours that they are providing right now, services are between 7 a.m. to 7 p.m., 7 days out of the week. And if there are callers, again, if for some reason somebody doesn't have access to the internet, isn't able to register online, there's a phone number that you can use to register. There will be call takers available to register, families, caretakers, people, individuals, in English and in Spanish. So again, this is just a personal decision for anybody that would like to receive the vaccine. Okay, I appreciate everybody's time. I know that we're past our time, I believe. So I don't know if we have any questions, or if there's anybody that has any questions regarding any information that was shared, the Mental Health Services Department, boundary settings, symptoms and signs of COVID, or even just vaccine information.